Because what happens is most of the times, whenever a person is suffering from any kind of illness, for example, a joint pain
Mm-hmm.
or a pain in his chest,
Okay.
they are always treated with medicines most of
Correct.
the times.
First.
Even I've seen in certain part of Africa, especially in central and western,
Uh-huh.
a patient needs an immediate surgery,
Okay.
but the patient is kept on hold for almost 6 months, 8 months. So I mean to say that you have to really do a lot of study.
Uh-huh.
There are a lot of consultants in the market with the help of which you can actually identify how these markets behave.
Right,
It
right.
shouldn't happen that you launch a product and by the time your registration is done, the technology has collapsed. Barring few countries, there are other markets which are open markets. They welcome Indian products.
Uh-huh.
So in last 10-15 years, what has happened is Indian products have gained a lot of acceptance
Correct.
because our quality, not only our quality is good, but we are economically priced. We
Correct.
cannot say we are cheaper, but we are economically priced. You need to first understand how the potential of the country in terms of whether the market lies for that
Okay.
particular product. You need Indian consultants
Mm-hmm.
who will help you to touch base with the consultancy
Mm-hmm.
within the country.
Mm-hmm.
And it's always good to have a consultant within the country because he knows the country well.
Uh-huh.
He knows the dynamics
Mm-hmm.
very well there. You should always, any company has a draft for non-disclosure agreement. You should always get the non-disclosure agreement firstly signed
Okay.
and stamped from both the parties. Why it is
Mm-hmm.
required? Because there are a lot of confidential documents which are exchanged between the distributors,
Uh-huh.
and it is always better to have that agreement signed so that your documents don't get misused.
Okay.
Okay.
Welcome, friends, to my show. The name of my show is The Venkatesh Show. The main idea behind this show is to inspire you, motivate you by introducing remarkable individuals. Today's talk is going to be on international business. We have today with us my dear friend and senior manager in international business, Mr. Vaibhav Sadam. Mr. Vaibhav Sadam, welcome to my show. And as I said, today's episode is going to be more informative. The reason I'm saying is that there are so many Indians or Indian business people who would like to know about international business, and there are very few people or very few business owners they know exact basic of international business. So I wanted to learn from you how actually international business works and what are the steps, what are the six steps that every business owner must know or should know. So first of all, welcome Vaibhav to my show.
Yeah. So thanks, Venkatesh. So just for the information of all who are watching this show, I and Venkatesh know each other for almost more than 8 years now.
Correct.
We have worked for some organizations together. We have been colleagues. We have been friends, and I'm really glad that he has started this channel. And the best part of this channel is he's taking efforts to make people understand the beauty of not only the beautiful countries across the world, but also the business dynamics which these countries have. So, Venkatesh, I have experience of selling medical device products into different markets like East Europe,
Uh-huh.
some of the West European countries. I also have rich experience of selling into West African countries.
Uh-huh.
So, when we talk about doing export business, there are a lot of things. Firstly, you should have a passport.
Okay.
Okay.
First requirement of
Yeah, you should
yes.
have a passport. Then you should have a fair understanding about the country dynamics.
Uh-huh.
When I talk about country dynamics, the country dynamics starts from population of the
Mm-hmm.
country, rich, poor, what
Mm-hmm.
kind of a country it is.
Mm-hmm.
Is there any currency fluctuation in that country?
Mm-hmm.
Especially what kind of currency is used for business point of view.
Uh-huh.
And you also have to see whether the product which you're going to launch in that country has potential in that country. For example, uh, I give you an example of launching a implant,
Okay.
joint implant, that is a
Uh-huh.
knee or a hip implant,
Uh-huh.
in a country like say Cameroon.
Okay.
The country is big. The population is close to around 2.5 to 3 crores.
Mm-hmm.
But when you go to that country, there are hardly any operation theaters
Okay.
or hardly any doctors or surgeons
Mm-hmm.
who are doing this kind of surgeries,
Mm-hmm.
because there are not no enough facilities.
Mm-hmm.
They are not expert into doing this kind of surgeries. So most
Okay.
of the time what happens is the patients who have money and who are suffering from illness which needs a joint replacement,
Mm-hmm.
they either travel to nearby countries, for example to Middle East,
Uh-huh.
to India, or to some of the European countries. These days, recently, what has happened is most of the doctors from India
Mm-hmm.
have started traveling to this African countries,
Mm-hmm.
where they go and train these doctors,
Mm-hmm.
especially in western part of Africa and central
Mm-hmm.
part of Africa.
Okay.
And joint replacement is just one example. There
Okay.
can be a CABG, there can be an interventional cardiology procedure,
Right.
there can be a neurosurgery procedure. So this doctor,
Anything which is, I would say, the related to medical devices or surgery related to medical devices,
correct,
because what we know, Africa is potential for pharma,
absolutely,
because they are struggling with, let's say, paracetamol, they are
correct,
struggling with basic telmisartan.
correct.
So they are there. I mean, that's the reason Indian pharma company is doing well in the African region.
So what you said is right, because what happens is most of the times whenever a person is suffering from any kind of illness, for example a joint pain
Mm-hmm.
or a pain in his chest,
Okay.
they are always treated with medicines most of
Correct.
the times.
First.
Okay, and they keep treating them with medicines till the time the patient doesn't succumb.
Okay.
Even I've seen in certain part of Africa, especially in central and western,
Uh-huh.
a patient needs an immediate surgery,
Okay.
but the patient is kept on hold for almost 6 months, 8 months.
Because of
Okay,
lack of
lack of expertise.
expertise,
For example, you need certain set of accessories, instrument set,
devices.
devices which are not available.
Mm-hmm.
If it's available, the doctor doesn't have the skill to use it.
Right.
Okay, so most of, now since the traveling has become easier, doctors from India, they travel,
Uh-huh.
help these surgeons. So the surgeons in Africa, they keep all the cases lined up.
Okay.
Maybe in a week they plan around 30, 40, 50 cases.
Uh-huh.
These are all the emergency cases which are lined up, and then accordingly the surgeries happen.
I think affordability is also a major concern.
Affordability is an issue. People who are affordable, they usually travel outside the country and get themselves operated.
Uh-huh.
Okay, for example, you must have also heard that India in the north was once upon a time hub for doing liver transplant cases.
Uh-huh.
Okay, patients from Afghanistan, from Pakistan used to
Mm-hmm.
travel to Delhi
Mm-hmm.
to get a hepatobiliary or a liver transplant done.
Correct. Correct.
Okay, because there were 5 to 6 centers in India, especially
Uh-huh.
like you have Global, you have Kokilaben, you have Medanta.
Correct.
These are some of the centers where liver transplant happens.
Yes.
Okay, but when you talk about liver transplant getting done in Central Africa or Western Africa, I still think
Mm-hmm.
they really lack the kind of expertise or the facility that is.
Mm-hmm.
So when you were talking about international business is something where you really need to find the product which you are going to launch has an acceptability in that market. Okay,
Product
yeah,
match, product fix,
yeah.
we
So
can
we
say.
always think that if the product is unique, it will sell. No, it's not that. You have a unique product, but does that product have that acceptability in that market?
Mm-hmm.
Okay, for example, I launch a beautiful implant or a beautiful stent or a beautiful coil for neurosurgery, but if that country doesn't have the potential to buy, the potential to have that kind of expert
Or
doctors who can
infrastructure.
treat, infrastructure, as rightly said by you, we cannot sell. So,
Right.
okay, so these are the different types of dynamics. Then sometimes it happens that there is a partner. So
Mm-hmm.
like when you start an international business, firstly you have to identify the regulatory aspects of that
Mm-hmm.
country. Okay,
Mm-hmm.
like it shouldn't happen that you sell and your product gets stuck in the customs. Why?
Uh-huh.
Because it's not regulatory approved.
Correct.
Okay, so in some countries the regulatory is quite easy. The product gets approval in a month or 2 months. But there are certain countries, especially in Asia, like when you talk of Philippines or Indonesia
Uh-huh.
or Vietnam, the
Uh-huh.
regulatory procedure is very harsh, and
Okay.
it takes almost 12 months, 18 months, even 2 years
Correct.
for the
Correct.
registration to get done. And after that registration, the technology has changed. Okay,
Yes.
so
Yes.
these markets are, so I mean to say that you have to really do a lot of study
Uh-huh.
There are a lot of consultants in the market with the help of which you can actually identify how these markets behave.
Right,
It
right.
shouldn't happen that you launch a product and by the time your registration is done, the technology has collapsed.
Uh-huh.
Okay. So that is one thing, the kind
Mm-hmm.
of market, the kind of product that you launch.
Mm-hmm.
Also, you have to see whether that market is already flooded with that kind of a product. For example,
Mm-hmm.
I give you an example for like a coronary stent, for example.
Uh-huh.
Okay, you have to see if the market already has a lot of Indian players, a lot of multinationals in that market,
Mm-hmm.
whether you will be able to sell that product, whether you
Mm-hmm.
will be able to enjoy that kind of a price.
Mm-hmm.
So this is one thing. Then, I mean, so these are basically how you
Yes,
initiate
yes.
into international
I mean,
business.
very true. Africa is a emerging market, but see what big mistake new business owner does is that when he think about international business, he goes to Dubai, he goes to London, he goes to, let's say, Spain or Paris, but that's not a potential market for us as an Indian manufacturer point of view. You need to, as you rightly said, you need to understand the market, whether it's potential or not for your product. Then the regulatory, definitely. But how I see, definitely, Africa is emerging market for
Correct.
Indian manufacturer. But if you see the 60% potential market, I'm talking about like in general, like in wholesome, I would say, or I think Europe is a biggest market for Indian manufacturers. The product is getting well accepted. The second biggest potential market is Latin America,
Correct.
starting from Mexico to till Brazil. You can take any country. Definitely, regulatory is a major part, but these are the two regions which is very potential for Indian manufacturer point of view. If you want to, let's say, segregate, I would say 60-40, 60% markets or 60% your business will come from these two regions, and then rest 40% business will come from rest regions. So that's how I look at. Here I wanted to highlight is that if you want to do business, international business, then don't go to Dubai, or don't go to Middle East at initial stage of your business. Because see, if you see the Dubai market is definitely is a completely reimbursed market. That means government pays 100% for your procedure or medicine or medical
Absolutely
devices.
correct.
But government pays only to the Dubai citizens or Middle East citizens. But if you see the actual Middle East citizens, there are very few Middle East citizens who getting treatment in the country.
Correct.
60% again they go to, let's say, London, to USA, to any other developed country, and rest 90% the diaspora from the India, from this Sri Lanka, from Bangladesh, from Pakistan, they are working there. But when it comes to the treatment, when it comes to the surgery, they go back to their own country. That's the reason the Middle East not potential at first initial stage of your business.
Yeah, even I would suggest that Middle East shouldn't be the market where you should initiate your business when you're
Ha ha.
launching fresh. When you're launching fresh, you should definitely focus on Latin America
Ha ha.
because barring few countries, there are other markets which are open markets. They welcome Indian products.
Ha ha.
So in last 10-15 years, what has happened is Indian products have gained a lot of acceptance
Correct.
because our quality, not only our quality is good, but we are economically priced. We
Correct.
cannot say we are cheaper, but we are economically priced. So when you were talking about markets, like when you're comparing Europe and Africa, both the continents have potential, but
Mm-hmm.
the difference is in Europe, they are technologically advanced. Uh, they know how to use the product, so that's the reason there are a lot of already players
Mm-hmm.
who are selling the products in the market.
Mm-hmm.
But in Africa, potential is there,
Mm-hmm.
but you need to develop that market. For example, you need to train those doctors on those
Okay.
kind of products. You need to have that kind of facility. So somebody Indian going there and putting up a big hospital with
Okay.
all the facilities, that
Uh-huh.
is the kind of start you need to do in Africa,
Mm-hmm.
which is not the case in Europe. Europe, the facility is there, the doctors are trained.
Right,
You
right.
have to give them new products. You have to give them some technically advanced product, and they will use it. Okay,
Right, right.
it should have a benefit.
Mm-hmm.
But recently, when it comes to commodity like of a commodity kind of a product, the burden of insurance in Europe is on the government. So
Uh-huh.
the government is preferring to buy products which serves the purpose, but also available to them at a cheaper cost, at an
Mhm.
economical cost. So this
Mhm.
is the case in Europe.
Mhm.
Okay, so when it comes to some of the implants which are deployed in a patient, the government will always prefer to buy. And these days, in last 15-20 years, there is a lot of acceptance to the Indian products.
Mhm.
But vis-a-vis when you go to Africa, the scenario is very different. When it
Mhm.
comes to a commodity product, it is only the price
Mhm.
which gathers more importance.
Mhm.
And I've seen like some of the countries in Central Africa, like DRC,
Mhm.
the price you don't enjoy much margins there. It is more
Mhm.
of a volume business.
Uh-huh.
Okay, and that it is not technologically advanced. So that is the difference between basically Europe,
Two
doing
markets.
business in Europe and in Africa.
2 points I would like to highlight. First is how world look at Indian products is that quality product at affordable price.
Absolutely.
The second important point, which is very important, is acceptance of Indian products globally is okay now. I mean, Europeans are accepting Indian products. They are
True.
welcoming Indian products. Latin America, they are they are welcoming. They are welcoming since ages because they respect us. Also, Russia is big market now after the Ukraine and Russia
Correct.
war, and definitely now the APAC also a big market. But I think APAC flooded with the Chinese companies or Chinese product.
So even I would like to gain some experience from you because I have never worked into Asian markets except Vietnam, where I've seen the market a bit closely.
Hmm.
I would like to understand from you how, like, if you have worked into like markets like Indonesia or
Hmm.
Philippines or Vietnam or Malaysia, Thailand, if you could just like to highlight why these countries take so much time to
Hmm.
get the product registered.
Uh-huh.
You think any is there any reason for that?
First reason is that the population,
Okay,
small population, small country. The second reason is Chinese company, influence of the Chinese company, because there are so many Chinese companies are there because the near proximity. That is the only two
okay.
reason I can see. I think yes, this is the first part which most of business owner they go wrongly, and they face difficulties in Dubai, they face difficulties in Middle East, and they think, oh,
Correct.
no, this is not our cup of tea. But I
And
think
when you talk about Middle East, you do you agree that Saudi Arabia is the biggest market?
Saudi Arabia is biggest market, affordable market,
Okay.
but again small compared to Europe and Latin America. If you are starting your international
And when you talk
business,
about Europe, any particular countries where you see that the business can move fast?
yes,
Like,
yes,
yeah,
right.
which one?
See, if you see the Europe geography, Europe is divided into two part: East Europe and West Europe. East Europe is a, I would say, the price sensitive market.
Correct.
They, I mean, definitely is a tender business. 100% or 90% is a tender business. If you see entire Europe, and if they are getting, let's say, €5 less price for any product in East Europe, they will accept or
They'll
you will
ship.
win the tender. But in case of the West Europe is developed countries. They don't bother whether it's a, your product is cheap or not,
Yeah.
because it's affordable market. No, they afford the
So
US
their
product,
major emphasis is on the quality of the product.
quality of the
The
product.
quality of the product. The
Right.
price doesn't matter to them.
Price doesn't matter to the West European countries.
Correct.
So I would request, or I would suggest, or I would recommend, if you want to start your business in European countries, then start with the East Europe part. East Europe part, that also Bulgaria, Romania, Hungary, Croatia, uh, Czech Republic, Poland. These are the very potential market for Indian,
Promising.
promising market. And if you go to any country, you will see minimum 30, 40 Indian companies are doing business. That means the Indian products is well accepted in those part of this one country. Then second is Latin America. Latin America is also very potential market, promising market. They look at Indian product as a superior product. Even Indians as a, they treat you as a superior
Correct. Correct.
citizens.
And yes, in last 10 years, maybe after the Modi government, even I have seen where I've traveled to a lot of African countries, also in East European countries, Indians have gained a lot of importance.
Hmm.
I mean, they treat you well. I mean, at some places, like recently I was in Paris, where at the immigration they had a separate queue for Indians.
Okay.
They had a separate welcoming counter for the Indians, so which is a good sign.
Right.
So globally, we are gaining a lot of
Respect.
respect. People are observing us, which is a good thing.
Right, right. So this is the first part which we have understood the region and market. Moving to the second part. So what would be the first step if you are approaching any country?
Yeah. So when you're approaching any country, you, as I mentioned before, you need to first understand how the potential of the country in terms of whether the market lies for that
Okay.
particular product. You have to also see how stringent the country is regulatory wise.
Uh-huh.
Okay, there are some open markets where regulatory is not much required, where selling is not that difficult. But there are some markets where the regulatory is very stringent, which may
Uh-huh.
take a long time.
Mm-hmm.
So you can categorize your country wise, like this would be your A category of countries, B category, C category.
Uh-huh.
So A category is when you're a startup, you'll first approach this A category of countries. For example, in Latam, if you go to Chile,
Uh-huh.
you go to Colombia, these are open markets. If you go to Brazil, Mexico, which are stringent, have regulatory
Mm-hmm.
requirements, same way. So when you go to Asia,
Mm-hmm.
Vietnam, for example, take almost 1.5, 2 years for
Mhm.
getting the product registered. So these are different things. When you go to European countries, the registration is not that difficult. If you have a C,
Uh-huh.
you can sell the product. There are
Mhm.
some countries, for example, Middle East. If you're selling in Middle East, if you have a C, uh, you might take longer time for registration, and also you may not enjoy a better price.
Uh-huh.
But if you have FDA, US FDA, you get a better price and you can even
Uh-huh.
sell the product more quickly. You can register the product more quickly.
Mm-hmm.
So these are different approvals that are required.
Right, right, right. So I know how I see regulatory is a door. Without that, if the door is not open, you cannot enter the
Absolutely.
country. So
Absolutely.
regulatory is a door which you have to open. To summarize your points, if you have CE certificate, then Europe is open for you. Also, some Latin American countries are also open for you. Additionally, if you have US FDA, then I would say 80% market is open for you.
So I would say that whenever any startup company from India wants to export, the first thing that they have to do is hire a consultant who is an expert from the regulatory point of view. There are some regulatory consultants who might take you for a ride,
Uh-huh.
saying that okay, this market is this market can be cracked easily. No, he should know what are the exact requirements and what is the exact time that it might take for the product to get registered.
Correct.
Also, when you are hiring a consultant in that country, that he should give you a clear picture of how much time it's going to take for the product to get registered, because it may happen that he may take almost a year and keep asking from you a lot of documents.
Uh-huh.
Every month he's asking for a new document, and at the end of the year he says that okay, it's still going to take time, the ministry people are on leave, there is some political issue in the country, and thus things get delayed, and ultimately you'll end up doing nothing.
Right.
You spend a lot of money, spend a lot of time,
Uh-huh.
and that's it. So it's always good to spend more on the consultants. You should always see that the experts that you hire are good at their work. If that is done, then I think your gates are open for doing business.
Yes, yes. And I think you will get consulted even in India, also outside also.
Yes. So obviously, you need Indian consultants who will help you to touch base with the consultancy within the country. And it's always good to have a consultant within the country because he knows the country well.
Uh-huh.
He knows the dynamics very well there. And I have seen a lot of Indian companies who make their employees travel on a regular basis to this country. So earlier I was of the impression that अरे यार तुम आप लैपटॉप पे यहाँ पे बैठ के डिस्ट्रीब्यूटर डोमेन एक्सपर्ट डिस्ट्रीब्यूटर ढूंढो, he will do the business for you.
Okay.
Why you need to travel to the country? But no, sometimes it is good to travel to the country. Why? Because when you yourself understand the dynamics better, it is good that somebody cannot take you for a ride. Because otherwise you will just keep believing that distributor, you will keep believing that consultant, and ultimately you will end up doing something which may be wrong. You are following something for a year and you ultimately come to know, oh, this is what I was following, it's wrong. It's
Right,
the wrong way.
right.
So always make 2, 3, 4 travels to the country, try to understand the distributor, meet more competitor distributors.
Okay.
Although you are not going to shortlist them as one of your distributor, but do meet them, try to understand them. This will help you when you are actually signing the agreement with the finalized distributor. This will help you to negotiate with him in a better way.
Mm-hmm.
Which products to negotiate, what is the price that you are going to, what territory you are going to offer him.
Right, right.
It's like that.
I think that's our third step, I would say,
Yeah.
to understand, I would say, the domain expert distributor or a right business partner.
Correct.
But if you see the basic process, how you approach or how you understand this is the right business partner for your business.
Yeah, so identifying the distributor is very crucial,
Uh-huh.
because you being into a country which is almost more than 8,000 to 15,000 kilometer away,
Correct.
like when you're in India. So when you're traveling there and trying to identify a distributor, you have to first see whether that distributor has a domain expert
Mm-hmm.
of selling the products which your company manufactures.
Uh-huh.
You have to see how financially strong that distributor is.
Uh-huh.
You have to travel with him in the market and see how good network he has in the
Contacts
market.
with the
You
customers.
have to also see whether this distributor has been a defaulter in the past.
Uh-huh.
Okay, you have to see his worth. So there are a lot of things. These are some of the things which, on the basis of which you can categorize whether this distributor can be on one of your uh, partner in the,
Right,
in the
right.
long run.
Right, right. Before that, actually, so many business owners ask me this question:
Yeah.
how you get the data, distributor data? So I think there are so many methods. First is you can find the export data. Through export data, category wise, you will get the business partner
Correct.
or contact details of the business partner. Then Google is second option. Through Google
Correct.
also you will find some distributor.
Absolutely.
Then LinkedIn, most of business people are on LinkedIn. Then I would say visit local conferences, because in local conferences you will find the real people, real customer. And then traveling is very important. Until unless you are not traveling, you will not get complete understanding, ground
Correct.
reality
Correct.
of the country.
Correct. No, what you said is right. So most of the time it happens that somebody is already selling. I'll give you an example of what. A coronary stent, for example.
Uh-huh.
I go to the country, there are 5 distributors who are selling coronary stents for different manufacturers.
Mm-hmm.
I may approach them, they will definitely not be interested to sell my product, because
Okay.
they already have a product and they don't want to breach their contract with that company.
Correct.
So obviously then whom will you look for? So there are some distributors who want to enter into a different segment. For example, somebody is into orthopedics or wound management, he wants to go into intervention cardiology. So that is your distributor.
Okay.
So as rightly said by you, visiting such congresses,
Mm-hmm.
you might get distributors who are willing to start a new business.
Right.
Then it might happen that, for example, a distributor had a contract with, say, a stent manufacturer like Abbott or Boston Scientific or Biotronic, and they are not enjoying that contract. Maybe they have certain issues and they are looking for a change. So that can be a potential partner for you.
Okay.
So this kind of potential partners you have to look at, identify it.
Mm-hmm.
So these are different ways, in fact,
Right,
how
right.
to identify a partner.
Coming back to our distributor approach or business partner approach, I think price is very important part. So how do you understand the price, exact price of that particular market? And once you understood the price, then how you negotiate with that particular business partner?
Yeah. So before we come to price, Venkatesh, I would like to highlight one thing. Whenever you have a partnership, finalized distributor,
Okay.
You should always, any company has a draft for non-disclosure agreement. You should always get the non-disclosure agreement firstly signed
Okay.
and stamped from both the parties. Why it is required? Because there are a lot of confidential documents which are exchanged between the distributors,
Uh-huh.
and it is always better to have that agreement signed so that your documents don't get misused.
Okay.
This is one thing. Then obviously before signing the international distributor agreement, there are few things which are like, there are a lot of 4 to 5 exhibits in the agreement. In that agreement, one criteria is price.
Okay.
So as rightly said by you, how you conclude what price is to be given.
Uh-huh.
So there are a lot of tenders which are floated online.
Uh-huh.
You can also take help from the distributor to share what are the prices at which a particular product has been bought by the hospital.
Uh-huh.
So any market internationally is divided into public and private market. So I have seen mostly around 70 to 80% or even 90% market in most of the countries is public.
Okay.
So it is only 10, 15, 20% market which is private.
Uh-huh.
So it is observed that in the private, you always enjoy a better price.
Mm-hmm.
But in public, the prices are almost set, and uh, but the volumes are good in public.
Mm-hmm.
So during this, so as I said, when you are visiting any particular country
Mm-hmm.
and meeting a lot of distributors before finalizing one distributor,
Mm-hmm.
so all these distributors give you a certain price expectation.
Mm-hmm.
Okay, why they give you this price expectation? Because so there is something called as a reverse calculation which they do. So
Okay.
the price at which they buy from you and the price at which they sell at the hospital, so there is a in between cost.
Mm-hmm.
So this cost can be categorized as different segments, like it can be a overhead cost for the
Mm-hmm.
distributor, the cost of his employees, the cost of marketing, uh, not only the cost of marketing, but there is certain cost which he may have to distribute at the hospital,
Right.
which we should not actually speak, but I mean, these things are understood.
Right.
So this gap we need to understand, and then ultimately one cost which is his profit.
Uh-huh.
So he has to consider his profit also. So most distributors enjoy a profit of anywhere between 15 to 40%.
Okay.
This net profit they want to enjoy if they want to actually exist or survive in the country or survive in that particular business.
Correct. Correct.
So, I'll give you an example. Recently, I was in interaction with a distributor from Egypt, and for a particular product, I would not like to tell you the product. He told me a price of around Xworks 100 and CIF 120
Dollar.
USD. And after a week, I happened to interact with another distributor who asked a similar for the similar product. He asked me a price of 40 Xworks and 50 CIF.
Okay.
So you can imagine the gap.
Uh-huh.
Okay. So in this case, which distributor would you like to opt?
Uh-huh.
Okay, the first one or the second one?
Uh-huh.
And the volume of business which the first distributor was going to give me was 5,000 units per year, and the other distributor was giving me 6,000 units per year.
Mm-hmm.
So obviously I'll go for the first distributor who is giving me a substantial number of units
Correct.
and who is giving me a better price. See,
Right.
the price is important. Why? Because if you go as low as possible with a price,
Mm-hmm.
you actually cut your hands.
Mm-hmm.
Okay, you have no room left to play.
Okay.
Because tomorrow, if you want to do any market development activity on your own, if you want to sponsor any doctor to visit India
Uh-huh.
to see the facility, if you want to sponsor any congress or a conference, to send your employees to attend some conference, you cannot do in that particular country if you have cut down your wings.
Right.
That is, if you have cut down your prices.
Uh-huh.
So you can always tell to the distributor when it comes to prices that, boss, this is my limit of price, but yes, we welcome you if you want to do any market development activities, if you want us to support in terms of samples for evaluation, you would always do that. Because once you cut down the price and then the distributor asks for support, you cannot do, and then the distributor gets offended. Oh boss, this company is not ready to support me. But they don't understand that the kind of price that I'm offering you itself is a big support.
Right. Right.
Okay, so that's my view about pricing.
Right. Right. So once you understand the right business partner, once you finalize the price, the next I think is the agreement part. So now you agreed that okay, this is my business partner with whom you are going to do the business. Then agreement is the official signing document. So what things that particular international distributor agreement contains?
So what I was saying, Venkatesh, is the territory has to be defined in the agreement. Okay. It may happen that the distributor. So when you go to European countries, the distributor follow the agreement. If you have given them a defined territory, they will follow to it. But in some countries, it may happen that there is you divide the country into say three parts. You have three domain expert distributors, but they keep throwing goods into each other's territories, and then the entire business gets spoiled. I'll give you an example why exclusivity or non-exclusivity is important. I'll give you an example of a country like say Vietnam. The prices are controlled by the insurance companies. If you have two distributors, okay, in that country, maybe say north and for central and south one distributor, and if you have given him price, if you are giving a separate price, or for example, if you are giving same price to both the distributors.
Okay.
But ultimately, this distributor is selling. For example, if you bill a product to a distributor for say $100, and one distributor is selling this product at $150 to the hospital.
Okay.
The another is selling 200 to the southern part of the hospital. Okay.
Okay.
Now the insurance company has an eye on it.
Okay.
Okay, and if this product is selling in volumes, big
Hmm.
volumes, then it comes to the insurance company is ready. Like these things get disclosed.
Ha ha ha.
Okay, then there is a question that the same product, why is it selling at two different prices?
Mm-hmm.
Okay, so that is the reason the distributors say that we need exclusivity so that they can control the prices.
Okay.
So the distributor has all the right. He can buy from you at 100 and he can even sell at 500.
Okay. Mm-hmm.
Okay, that is one reason. So when you talk about agreement, territory is very important.
Mm-hmm.
Then the second clause is the price.
Mm-hmm.
The third clause is the products which you are going to sell, the SKUs that you mention inside the agreement.
Mm-hmm.
So this is what I think is important, and the payment terms.
Right,
Like
right.
you are going to pay advance, you're going to pay on credit, letter of credit,
Mm-hmm.
kind of.
Yeah. So once you sign the agreement, then next stage would be getting small order or sample order.
Correct.
It might be for evaluation purpose. So I think no matter which country you are approaching, until unless they are not trying your product, they will not give you big commercial order.
Correct. So what you said is right. Say again, it depends from country to country. So every country, every continent, every country has a different law, has a
Uh-huh.
different rule. Okay. For example, there are some countries which cannot even buy your products for evaluation purpose unless the product is registered.
Okay.
Okay. There are some countries which can order your products for evaluation purpose, but your agreement is not signed. It's fine. So you cannot say these are steps, but the steps can be, some step can be at third position, some can be at first position, some can be at fifth position. But these are all the requisites which are required for international business. You need to have a non-disclosure agreement. You need to have an international distributor agreement. You need to have a domain expert distributor. You need to define the territory. You need to
Okay.
define the price. So these things are much required.
Right.
So okay, can you please repeat your question?
Yeah, see, I was saying that, okay, before getting your big commercial order, how the sample order or evaluation plays an important part.
Yeah, so it happens that once your product is registered in the country, the customer would like to give the product for trial purpose. So this he can even do before the agreement is signed. Okay, so once the product is given to the doctors for trial purpose, there are certain feedback forms which you can give to the doctors, and they can fill the feedback forms, give their feedback. And once the distributor is confident that okay, this product has been liked by my doctors, then he can start procuring from you. So he will look at, if the private market is asking for say 1000 units per year, and if the government market or the tender market is asking for say 10,000 units per year. So depending upon whether how many, like for example in some country there are contracts with the hospitals, or the government has contracts. So if some distributor has won that contract is for 2 years, for 1 year, for 5 years. So that time, even if your product is registered and the distributor is willing to buy, he cannot sell because some distributor already has a contract for that kind of product.
Right.
So these are certain dynamics.
Right. So I think after signing the agreement, after sample evaluation or small purchase order evaluation, the next big thing is commercial order.
Correct.
Right. When we talk about commercial order, there are two parts which we need to consider. First part is a logistic. So there are certain logistic terminology or the process or the logistic parts or aspects by which you can send the shipment. The second important part is that yes, you are sending stock or shipment to any other third country. How you are going to get the payment? So there is particular process by which you need to follow, and with that process only you will get the payment back.
So what I rightly understand, you are trying to talk about international commercial terms, if I rightly understand.
Right.
So as far as what I know, there are different types of international commercial terms like X works,
Right.
where this Incoterms you usually talk when you're deciding the pricing. Okay, so if you're giving him a price, say Xworks international Xworks price, if you're giving him an example is $100, fine. The distributor has to arrange a consultant who will pick the goods from your warehouse and take it along with him. The other thing is, if the distributor says that okay, you have to give me the product till the Indian customs. Okay, you have to clear the Indian customs. So that is like FOB.
Right.
the freight on board. So there your price might increase. You will say that okay, my price, if you want the goods FOB, I will give you 120 USD is
Correct.
my price. The distributor says that no, I want the goods till my port. You have to clear my customs and give it to me.
Correct.
Or the distributor may even say that no, the product has to reach my warehouse.
Right.
So the price will go and increase. If he says that okay, you want X works, my price is X. If you want FOB, my price is X plus 1.
Right.
If you want CIF, my price is X plus 2 or X plus 5. Whatever.
Right.
Okay.
Right.
So that's how you come to a price conclusion.
Second, yes, I mean, you rightly said there are three ways by which you can send the shipment. First is the X work. That means distributor has to come and take the stock to his
Correct.
country, and the FOB and CIF. Uh, okay, once you send the shipment, then how you are going to take the payment in your bank?
So basically, usually what happens is whenever a distributor gives you a purchase order, a signed purchase order, the company, the manufacturer first identifies whether he has all the goods available with him, on the basis of which he generates a PFI, which is called as a pro forma invoice.
Okay.
This pro forma invoice is given to the distributor. Then the distributor submits this pro forma invoice to his bank, and the bank does the transfer.
Okay.
So once the bank has done the transfer, there is a proof called as a SWIFT.
Okay.
SWIFT copy. There is a SWIFT number which is generated, which they share with you. You have to check it with your bank if the money is received on the basis of that SWIFT. Once the money is received, you can then decide to dispatch the goods.
Correct.
So again, there are different terms. If it is on 100% advance, you have to see whether 100% advance has been received. Okay, if it is like 50% advance and 50% credit for 30 days, then you have to just see that 50% advance is received, and maybe at the end of 30 days you have to remind the distributor that you're due for the payments, and you make the necessary payments.
Correct.
These are
Correct.
different.
Right.
There are some countries who also do letter of credit, where the bank is the guarantor for your payment. The bank gives a guarantee of letter.
Right.
So
Right.
again, in letter of credit, it is around 30 days LC or a 60 days LC or a 90 days LC. But the bank, so at the end of 90 days, the bank transfers the money to you.
Correct. Just one point I would like to add here. When you are dealing with any international bank, there is one intermediate bank plays very important role. The bank like the Citibank, Morgan Stanley Bank. Let's say you are A bank dealing with the B bank. So your A bank is in India, B bank, let's say, in Spain. So A bank don't know B bank, but there is a one bank which is called a Citibank,
Correct.
intermediate bank. They know A and B.
Correct.
So here the intermediate banks take some part of, let's say, the commission charges, and they do the transaction.
So that is safe. In fact, there is always an intermediary bank like HSBC or maybe ABN AMRO, whichever you said. So there is always an intermediary bank which is involved.
Right. Mainly international business happens in a two currency,
Correct.
Euro or USD. So talking about European countries, they deal in a Euro currency. When it talk about the Latin American countries, whether even in Middle East countries, they deal in a USD.
Correct.
Yeah. So once you get the payment, the shipment is done. The next stage, how you are going to consolidate your business.
Yeah. So what happens is when you dispatch the goods will reach the end user customs, and for the goods to get released from the customs, there are certain documents which the manufacturer has to send, like an export invoice or a packing list or a declaration of conformity, or maybe certain set of more documents which the manufacturer usually has it. Once you share these documents with your distributor, he is able to release those goods from the customs and take it along with him.
Okay.
So once the goods reach him, then actually the game begins.
Right.
Where the distributor has to do a lot of market research. He has to meet a lot of customers, do a lot of market development activities, and he has to always work on his secondary. Okay? Because he will keep buying from you, but if there is no secondary, which is the rule for all business.
Correct.
Unless the good is consumed at the end user, there is not going to be a repeat primary order for you.
Right.
So you also have to help the customer, the distributor, from doing market development activities, where you can visit the country, where the doctor gains confidence when
Mm-hmm.
actually the somebody from the manufacturing site is
Mm-hmm.
company is visiting him,
Mm-hmm.
and then it happens that ultimately the usage of the product increases because of
Mm-hmm.
that. There are a lot of things which um, Indian manufacturers do is that they call a lot of doctors to visit their facility.
Right.
They take them to visit around the country, and a lot of
Mm-hmm.
doctors these days they like visiting India,
Mm-hmm.
especially the north and the northeast part of India, which is
Mm-hmm.
very pleasant if you
Mm-hmm.
have been there. So these are the things which you have to do for having repeat orders
Correct.
regular basis.
Yes, I mean most of Indian manufacturers, they don't see training and the marketing part as important as the basic appointing distributor or something. I would say if you want to get a repeat order, then any manufacturer should focus on training part, training to the distributor's employee, training to the distributor sales person, because as a manufacturer we know our product well.
Correct.
uh, that's a training and marketing part is one. Second part is that gradually, or once in a 3 month, once in a 6 month, you have to visit that particular country, you have to meet real customer and then understand the challenges. The next big part is a tender business, right? So how do you see tender business? Like, I mean to say that whether tender is depend upon your personal relationship, or tender business is depend upon price, or whether it's a quality. What parameter you need to consider if you want to win the tender?
See, as far as what I understand about tender business is all about connection.
Okay.
The local distributor should have a strong relationship with the Ministry of Health.
Uh-huh.
When the specs are allotted for a particular product, you should be in a position to maneuver those specs.
Okay.
Okay, see to it that the specs are in your favor.
Mm-hmm.
That is one thing. If I think that is done, then the second thing is there is a set of doctors who
Mm-hmm.
are the part of the quality team.
Okay.
You have to ensure that these doctors have used your product and have a good feedback about your product.
Uh-huh.
Okay, and then third thing, obviously the most important thing is the price. You should
Okay.
be aware about last year or before that at what price the product had won the tender.
Uh-huh.
So you have to be competitive and give the lowest price.
Mm-hmm.
That's it.
Okay, okay. The next part, I think, since we are from the medicine pharma industry, how clinical trial plays important role?
There are certain countries, especially Middle East and countries in Asia, also some of the European countries, they see they use a product on the basis of how old the product is into the market, how
Mm-hmm.
clinically proven the product is.
Mm-hmm.
You may say that okay, this is a new product which is the best, but
Mm-hmm.
has it been clinically proven? Okay,
Mm-hmm.
for example, you eat certain kind of cookies, you use a certain kind of shampoo,
Mm-hmm.
you use certain kind of toothpaste or a
Uh-huh.
shaving cream. On what basis do you use all these products? Why? Because these have been used since ages.
Uh-huh.
There hasn't been any contraindication with that product.
Correct.
The product is effective,
Uh-huh.
and it's cost sensitive. Okay, cost wise it's effective, the product.
Mm-hmm.
So same happens with any kind of medical device or a healthcare product also. If the product is not effective, it's still fine. But
Uh-huh.
what if the product is giving you any contraindications?
Mm-hmm.
So there were a lot of cases where in the western part of Africa there were some products which were exported from India,
Mm-hmm.
and the children they consumed the product, and there were a lot of fatalities,
Mm-hmm.
fatal issues which happened in those countries, which was um, I don't know whether it was because of the product or some other issue, or maybe it was not given in the right dosage form. So
Uh-huh.
that is the reason companies countries always say that your product is good, your product has CE, your product
Mm-hmm.
has FDA, fine, but is it clinically proven? That means,
Okay.
are there enough clinical trials,
Okay.
maybe a RCT or a randomized clinical trial done with the
Mm-hmm.
product vis-a-vis comparison with the currently existing products in the market?
Uh-huh.
And then there are certain parameters on the basis of which a product is judged whether it is effective, yes, but are there any contraindications with that product?
Right.
So that's why there are maybe there are some countries which may not ask for a clinical trial,
Uh-huh.
but there are some countries where the potential is huge.
Mm-hmm.
They may ask for a clinical trial.
Okay.
So any manufacturer should be prepared enough to do that kind of investment, because getting a clinical trial done in European or a Latin American or a Middle East country, there is a huge cost involved in it. There is a huge time that you invest in it.
Okay.
It's almost like 2 years, 3 years, continuous trials.
Mm-hmm.
So it's very important to have a clinical trial.
Okay, right, right. Coming to the profile part, international business manager, let's say, what kind of personality has to be he has to be possessed,
Yeah,
like
very
uh, uh, travel internationally to do business in another country is not everyone's cup of tea.
absolutely, absolutely. So what you said is right. When you're doing business in domestic, it what happens is you can talk in your local language. People know you, people know where you stay, people know where you are associated with. But when you go to internationally, there's a lot of image that you carry about yourself, about your country. Okay.
Uh-huh.
So, for example, when you're going to meet a customer, how well groomed you are.
Mm-hmm.
Like, I worked for some organizations where my seniors have even advised me that how well your hair is cut,
Uh-huh.
how well you have trimmed your beard,
Right.
then
Even
how
nails as well.
your nails, the kind of belt that you wear, the kind of socks that you wear,
Mm-hmm.
the color of your blazer, the color of your trouser should match
Right.
the shirt that you're wearing. So there are, you have to be really well groomed. You have to wear
Right.
a tie. You have to be very soft spoken.
Mm-hmm.
Okay, so this is why, because it is a kind of image that you carry about yourself. See, in any business, you have to first sell yourself.
Right.
Once you are sold,
Mm-hmm.
the products which you want to sell get sold automatically. So you have
Right.
to first
Right.
sell yourself, then sell your company, and then ultimately it is a kind of image that okay, this is an Indian manufacturer. Okay,
Uh-huh.
so it's a perception that you carry. Okay,
Right.
so you are actually laying a path for other manufacturers when you are
Uh-huh.
going. So it becomes easier for other manufacturers also. For
Mm-hmm.
example, recently I heard there are a lot of Indian companies who are doing well
Uh-huh.
into interventional cardiology, into orthopedics, into diagnostics,
Correct.
because of which what is helping the new manufacturer is that it is creating a path for the other manufacturers.
Mm-hmm.
So this is what it is. You have to be very
Right.
well
Right.
groomed, very soft spoken. Whenever you are visiting country, even when you're taking a cab or you are going to a local restaurant, you have to be very soft spoken.
Mm-hmm.
Because people observe you. You may think that you are alone, so nobody's seeing you, know, but people observe you.
Mm-hmm.
And since you are an Indian and you are into Europe, so easily people come to know either you are from a Asian background.
Right.
So there are a lot of things which you need to take care. You have to be very soft spoken at the immigration. You have to be soft. You have to follow the rules
Uh-huh.
while crossing the road. For example, I have seen that there were people who there was a red signal, but still they were trying to cross. So one lady told boss, "Don't cross because the children are observing you."
Ah,
Okay,
yes.
so if you do something wrong, the children will learn something wrong from you.
Mm-hmm.
So in most of the countries, white is white and black is black.
Correct.
There
Correct.
is no gray area.
Mm-hmm.
So हम बोलते हैं ना चलता है इंडिया में. So there is no this चलता है kind of attitude anywhere.
Uh-huh.
Okay. So something which you have to follow, you have to follow.
Correct.
Okay.
Correct.
And whenever there is no signal, and if there is a zebra crossing, if a driver comes, he will ensure that you walk first and cross the road
Correct.
till he goes. Even if you are standing, he will ask you to pass by.
Correct. Correct.
So that is the beauty.
Correct.
Okay,
Correct.
so these are some things which we have to inculcate first in us. People will observe us and maybe try to learn.
Correct.
You should not go to teach everyone.
Uh-huh. That's
Okay,
true.
these are some of the things. This is
Yes.
basically
Yes.
call it etiquette.
Yes. Yes. Talking about cross country culture,
Yeah,
how do you see? Like for example, see, we Indian, we greet like shake hand. In some European country they greet with the cheeks. So what I see is that uh, though it's their culture, don't like greet with their cheeks to cheeks, maintain some proximity,
correct.
because again they don't like the very close association with you.
Absolutely. So what I said before is, you whenever you're visiting for the first time,
Uh-huh.
always observe.
Uh-huh.
Always observe what people do, learn, and then try to move ahead.
Correct.
So as rightly said by you, it's not only in Europe or in America, but also in India. If somebody tries to be too close to you, you may
Uh-huh.
not like, you may get offended. Okay, so it's not about just shaking hands. It's like you may not shake hands with everyone, you may not give a formal or a professional hug to everyone. It's maybe after repeated visit, once the person starts knowing you, starts liking you, then you develop that kind of confidence. But if you try to cross a particular limit,
Correct.
the person feels offended. So
Right.
these are very minute and small things, but we really need to adhere to these things.
Yes, yes. Uh, Next, I would say to have a good success, you need to understand two, three important part. First is definitely the geographical or geopolitical situation of that particular country. What is the political situation is happening?
Correct.
The second thing is that economy, how that country is stable in terms of economy, whether it's any other political things is happening, any political chaos is happening in that particular
Correct.
country or not. Then third, I would say you have to keep your eyes open, like okay, which is the easiest mode to travel, what is the local currency, what is the conversion rate, then which is the biggest airport, which is the second biggest airport, then comes to population, then the price affordability, etc. So how do you look that 4 5
Yeah.
points?
So I'll give you an example. So usually what happens is, it's not that, for example, if you're doing business in Europe, and if you're doing initially on a advance payment, 100% advance, maybe after 2 or 3 orders, you may shift the distributor on credit basis, maybe a 30-day credit or 50% advance, 30-day credit. But usually, when it comes to Africa, it's not that the people in Africa are bad. It's the geopolitical issues in the countries which are so weird and so unpredictable that you may not like to do any kind of credit business with these countries. I'll give you an example. For example, a country like Nigeria, if you go to an ATM and try to withdraw a dollar, maybe you just say that okay, you want to. So, for example, in the ATM, the price of $1 is around 450 naira. Okay, but if you give that $1 to somebody who is outside selling currency on the road, he gives you 700 naira per dollar.
Okay.
And the bank is giving you 450 naira per dollar. So that is a gap. That is a fluctuation gap. So what happens is, it may happen that the distributor gives you an order for say $1,000. That time the naira price was around 450. But again the naira price has gone up, say gone to 700. Now the distributor has to give excess naira to the bank to get that $1,000 so that he can pay us.
Correct.
So this is the fluctuation in the currency, which is very unpredictable in some of the countries in West Africa and Central Africa. That is the reason you always stick to a 100% advance model. And you will also see that in Europe or some of the Latin American countries or Middle East, your order size is 50,000 euro or 100,000 euro or 200,000 euro. But when it comes to Africa, your order sizes are very small, $5,000 or $10,000 or maybe $20,000, $25,000. Why? Because of this currency fluctuation, even the distributors are scared.
Correct.
That I am giving the order today, and I'm making the payment to this distributor once the goods are ready. By the time, what if the currency has fluctuated so much that I have to pay excess his local currency to the bank to get that much amount of dollars?
Correct.
Okay, so this fluctuation needs to be observed very carefully.
Correct. As international business requires so much traveling to big countries, traveling to small cities, traveling to interiors. So any unsafe incidents happen to you?
So how much ever people say that okay, this country is safe to travel or this country is not safe to travel, it is ultimately you have to decide which part of the city or which part of the country you would like to travel or not to travel. For example, I have traveled across like 7 8 countries in Europe, and so to some countries in Asia, and to some, I've even traveled in West Africa, like where it is said that you should not travel before 10 a.m. in the morning and after 5 p.m. in the evening.
Uh-huh.
But still, I've been outside.
Uh-huh.
But it also depends upon which area you are. For example, if you go to Google, is India is safe to travel?
Uh-huh.
It comes, no, India is not safe to travel.
Correct.
But have you faced any incidents in India ever? No, never.
Correct.
But yes, if you're going to some part, maybe a slum area where you have people who consume alcohol or some kind of drugs or something. Okay, so usually in Africa it happens that in certain parts of Africa, when I'm talking about Africa, the continent, it's certain countries in West Africa, and in those countries also certain areas where there is a lot of incidences of robbery because why would someone rob you? Okay, because he's hungry. He's hungry for food. So I was in Kinshasa, which is the capital of DRC, where I was just talking on the phone, and luckily my glass was slightly open. So he tried to snatch the phone, but the phone couldn't come out, and it banged, and the phone fell on my lap.
Okay.
Okay, so that was one incident. Then I was in a city called I think Valladolid, which is in north of Spain, which was really unexpected, and it was evening around 7. And I was at Ibis that time, in Hotel Ibis, and I went to the supermarket walking, which was almost like 1.5 kilometers. And when I was returning, I was just like 300 meters away from my hotel,
Okay.
and I saw one dark fellow who was on in his car, and he parked the car, and he just told me, "Give me the bag." And I am like, I just tried to escape and ran towards my hotel. He just came towards my gate, and he pointed finger at me that something kind of in his local language, maybe in Spanish, and I ran inside the hotel. So these were some of the unavoidable incidences which happened, luckily.
Right.
So you have to be safe when you travel. So people will say that okay, इधर तो तुम जा सकते हो, यहाँ पे कुछ नहीं होता. No, somebody is telling you this area is safe, still you have to be careful. Somebody is telling you this area is not safe, it's better you don't travel to those areas, because the worst thing is you don't know the local language.
Correct.
Okay, the police also understands local language. They may not be able to understand English. So the first thing that they would do is take your passport. And when your passport is taken, what would you do there without a passport?
Right.
Okay, so but the best thing about traveling internationally, especially in Africa or Middle East, there are a lot of Indians there. You try to make friends with those Indians and try to take their help.
Correct.
So it is not that difficult these days. But as rightly said by you, it's better you avoid traveling to unwanted places.
Yeah. Be alert. See who is.
Be alert. Absolutely.
Be alert.
Be alert.
While walking, who is behind you, who is beside you.
Absolutely.
And don't go like unsafe places.
See, I have taken a lot of international distributors and clients to some of the most crowded places in Mumbai, like Gateway of India or South Crawford Market or Kulaba Market. And they have themselves told me that, boss, this is very safe. You can just roam around.
Correct.
And it is actually safe.
Right.
Mumbai is safe. Because the law in Mumbai is very, the police, people are scared of the police, and the security is, the people trust the security in Mumbai. Right. So that is an advantage that we have.
Yes.
And it is always said that I think Mumbai police ranks second or third in terms of like Scotland is at number 1.
Right.
So this is an advantage that we have.
Yeah. See, I also traveled Mexico, Peru, Uzbekistan. Before going to that country, I was very worried whether Peru is safe or not, whether Mexico is safe or not, because we are hearing like these are the not safe countries. Some bad things happens in those countries. But after traveling, I can say very much safe. The countries are very much safe. The only thing is that you have to be alert. You have to take care of certain things.
Yeah. So basically, to these young entrepreneurs, basically who are startups and who want to enter into international business and exports, I would tell them that you start learning languages. Okay, French is widely spoken in Central Africa and West Africa.
Correct.
Spanish is spoken very widely in Latin America. So if you know at least these 2 languages, you can communicate fairly.
Correct.
Arabic If yes, you can talk fluently in North Africa,
Uh-huh.
Middle East, if you know Arabic. So if the young entrepreneurs are knowing these languages, it becomes very easy to do business. Okay.
Uh-huh. Correct, correct. I think though you cannot speak correct language, whether it's a Spanish or
Yeah.
either it's a French, but even if you're speaking basic, they will appreciate.
Absolutely. So there are tools available like Google Translator, etc. But yes, if you learn a bit of their local language, I've seen that people respect you.
Uh-huh.
People are scared of you. I mean,
Uh-huh.
especially I've been to Central Africa, and one of my friend there was talking fluent French, and he
Hmm.
was talking fluent local Lingala language,
Uh-huh.
and the Africans, they won't mess with him
Right, right, right.
because he knows the language. So they know that this guy can take us. I mean, till the police.
Correct, correct,
So
correct.
it's always good to know the local language.
Yeah. So after spending 8, 10 years in international business, what are the three things which any Indian manufacturer or business owner need to consider if you want to get success in international business?
I cannot say there are three or four things, but there are few things which he should understand. Um, one is what kind of product that he is going to start manufacturing, and has he done enough study about the acceptance of this product in the
Uh-huh.
market? Are there already too many players for that product?
Mm-hmm.
Or are there too many manufacturers planning to come out with this kind of product?
Mm-hmm.
Then it becomes a very crowded place for you to
Mm-hmm.
sell the product, and then you don't enjoy the price.
Mm-hmm.
Then are you willing to understand the market and come out with something new?
Mm-hmm.
For example, there is a commodity product. For example, I'll give you an example of a suture. Okay,
Mm-hmm.
there are a lot of basic sutures available in the market,
Mm-hmm.
but there is something called as an anchored suture, or
Mm-hmm.
a suture which is very useful when you're doing a laparoscopic surgery
Okay.
or when you're doing a robotic surgery.
Mm-hmm.
It helps you to do better maneuvering,
Okay.
and these are knotless sutures. You don't
Mm-hmm.
need not take knot. The surgery, like for example, if you're doing a bladder surgery with a robotic approach,
Uh-huh.
something which is going to take stitching time for around 30 to 45 minutes,
Okay.
with the knotless suture it takes around 5 minutes.
Okay.
Okay, so if you're coming out with a unique product, nothing like it, then you just have to identify bigger prospering markets and start selling the product. So this is
Okay.
one thing when it comes to product. He has to have patience.
Uh-huh.
Okay, patience is required. It's international market is not something that you just go and somebody accepts you,
Correct.
because they see India as a third world country.
Correct.
They don't know you. You have to do
Correct.
a lot of branding for your company, branding for yourself.
Mm-hmm.
This is second thing. Then he has to be very clinically strong. The manufacturer has to be very clinically strong. He has to have all the necessary approvals
Mm-hmm.
required from the point of view of regulatory registration. He might say that, okay, I don't have these documents because it's very costly affair. I don't want to invest that much.
Uh-huh.
So he will never success. Okay?
Mm-hmm.
So there are certain protocols, certain documentation which is required,
Correct.
which the manufacturer has to adhere to it,
Uh-huh.
and he should be ready to invest.
Mm-hmm.
Okay, because what you it's like sowing a seed in the soil.
Mm-hmm.
Till you get the fruits, you have to wait.
Correct.
Okay, you plant a seed today and you get a fruit after a year. It's not nice.
Mm-hmm.
You have to put optimum quantity of water, good quality fertilizer.
Mm-hmm.
Lot of nurturing is required. So business is like nurturing.
Mm-hmm.
You have to nurture your business.
Correct.
Nurturing is you have to understand. You have to understand your business. You have to understand your customers.
Mm-hmm.
You have to understand your market well. So it is all about understanding. It is not if somebody is just launching or manufacturing a product to make profits,
Mm-hmm.
then he may not succeed. But if somebody is trying to nurture his business, the long term results are going to be fruitful. That much I can say.
Okay, okay. Yeah. With that positive note, we'll end our discussion here. Thank you, Mr. Vaibhav Satam, for coming to my show and sharing your, knowledge and valuable things. Uh, Friends, thank you for watching this episode. Lastly, I would like to thanks Hosmart. Hosmart is the sponsor for this episode. Hosmart Healthcare is the company which is related to healthcare infrastructure. If you want to build your hospital, if you want to build your clinic, Hosmart Healthcare also helps to hospitals to run their businesses in a professional and successful manner. Thank you. Thank you, friends, and I will see you in the next video.